Okay, madam. Take away.
Yes.
100% satisfied.
100% तो हाँ ठीक ही है सर.
क्या हो गया? क्या प्रॉब्लम रही?
अभी पता नहीं चल रही.
देखो इसको अच्छी से बाइट करो तो फिर बताना मेरे को ना मैं ठीक है.
ओके.
आई एम हियर ओनली.
ठीक है.
इट्स अ वेरी लेबोरियस वर्क. ओके.
ठीक है.
हाँ, इट रिक्वायर पेशेंस. ठीक है, अभी देख लीजिए इसको फिर हम बात करो. ओके.
ठीक है.
ओके ओके, बात बच्चे. ओके.
आइए मैडम बाहर अच्छी तरह.
पेशेंट को बाइट है.
ओके सर.
अच्छा एक बात बताइए सर, बस जैसे दांत हम लोग भी तो आगे पीछे करते हैं तो किरकिर तो आवाज़ आना चाहिए, नहीं आना चाहिए?
वैसे तो नहीं आना चाहिए सर.
पेशेंट को डिस्पोज करो.
ओके.
पानी पिलाओ.
आज का केस भी बड़ा डिफिकल्ट था सर. सेटिस्फाई होके नहीं दे रहे थे पेशेंट.
पेशेंट चला गया.
हाँ जी सर.
दवाई बंद करो.
क्यों आ रहा था साउंड ऐसे सर उनके? हम आगे पीछे करते हैं, हमारे तो नहीं आता साउंड दांतों में.
हो जाता है आपके पास. इसको बोलते हैं occlusal problem.
ओके.
The teeth, they don't lie in isolation. They don't work in isolation.
ओके.
They are in the mouth with so many other systems. There is a musculature system, there is a bone, there is periodontal ligament, there is tongue, there is cheek, there is TMJ. Okay, there is a pharynx,
ओके.
there is a palate, there is soft palate. So there is erupting for there are many occlusal forces are there.
Okay.
So teeth cannot work in isolation. They have to work in tandem with other forces.
ओके.
So there is a need for occlusal harmony, occlusal balancing.
ओके.
So they have to bite in a multi-pointed, balanced occlusion.
ओके.
So if there is a interference, what we call supra-contact,
ओके.
occlusal prematurity or high point,
हाँ सर, बड़ा हाई पॉइंट पे बहुत जोर दे रही थी वो.
it's not only high point.
तो हाई पॉइंट किसको कहते हैं सर?
High point होता है when the, like if you are sitting here, if I say you sit here
अच्छा.
and I put a needle
Okay,
Yes.
sir.
and I tell you to sit here, so how will you feel?
ओके सर.
This is high point.
ओके.
So finding the right needle and removing it, that is occlusal adjustment.
ओके.
We call it occlusal therapy or occlusal rehabilitation.
सर लेकिन इससे पहले भी आपने कई बार क्राउन्स लगाए हैं, इनले लगाए हैं, ब्रिज लगाए हैं, किसी को इतनी प्रॉब्लम नहीं है. आज इन मैडम को क्यों थी?
There are many things here. She kept on saying high point. There are many things. There is occlusal prematurity, there is a retroactive prematurity, the the lateral prematurity, excursive prematurity, plunger cut, wear facet,
Okay.
then functional mandibular system, movements. So every time she changed her verdict, there is a marginal discrepancy. When I corrected it, then she tend to say the other thing.
Okay.
There were many things in her case. So she required a occlusal balancing. So there is a need for occlusal examination. The occlusal examination is inseparable part of any oral examination.
Okay, sir.
Because teeth do not lie in isolation, they have to work with each other as well as from the other arch.
Okay.
So there is a need for occlusal examination to find out, is there any plunger cut? Is there any food infection?
Okay.
Is there any sharp point, a cheek biting, a lip biting, a food infection, a palatal impingement, or TMJ problem?
Okay.
Okay. So there is a need for proper occlusal analysis. Apart from periodontal dental examination, soft tissue examination, oral examination, and musculature examination, there is a need for occlusal examination,
Okay, sir.
whether they are biting in proper intercuspal position,
Okay.
is there any centric relation, is there any proper freeway space, or is there any proper vertical dimension, whether there is a occlusal interference when the patient bite in centric occlusion.
Okay, sir.
So if there is even a one interference, it will not allow the multi-pointed balanced occlusion.
Okay.
What we require is stable, multi-pointed, controlled, functional, normal occlusion, where patient can smoothly grind and glide without any interference.
Yes, sir.
So if there is any high point in retroactive position, or there is excursive lateral excursion, or the left lateral excursion,
Okay.
or protrusive movement,
Mm-hmm.
you need to shape it, reshape it by selective grinding of part of tooth, which is creating interference.
Mhm.
If there is a plunger cut, then you have to give the shape in a manner it fix harmonizing with the other teeth.
Okay.
There is a proper cuspal fossa relationship.
Okay.
So the occlusal adjustment is not only the grinding of the teeth. There is a proper harmony. There should be a proper harmony. There's suppose you have done the RCT. So tooth is compromised now. So we need to give a prophylactic reduction of the crown so that it does not fracture with the occlusal rod. Okay. So whenever you find the tooth is mobile, tooth is compromised, is not
Okay.
taking the load, you need to reduce it
Okay, sir.
so that there is a balancing of occlusal forces.
Okay.
It should not jeopardize. Okay. So if there is a plunger cast, if there is a food infection, or if there is a palatal impingement by the incisor,
Okay,
we
sir.
want the incisor guidance. We want the multi-pointed protected occlusion. We want the cuspal guidance. We want the cuspal fossa relationship. Okay, we want the interdigitation of the teeth. So there is a proper scheme of occlusion. The teeth, they need to articulate with each other as well as from the opposite tooth.
Okay, sir.
So there should be a ICP and RCP should coincide. The incisal point as well as retrusive cuspal point should coincide. There should not be prematurity while the tooth glide from centric lesion to centric occlusion.
Okay, sir.
So there is a proper steps. So first you have to reduce the retrusive occlusal interference, then the centric occlusal interference,
Okay.
and then protrusive interference, then lateral excursive interference,
Okay.
and then you have to check the gross occlusal disharmony,
Okay, sir.
and then you have to again review it, whether it is, because occlusion is not a static, it's a dynamic, constantly changing. So after you have done reshaping, then again you review it and then finally polish it.
Okay.
So there are proper steps
Okay, sir.
for occlusal harmonizing, occlusal balancing, occlusal stabilizing. So these are the it's a sort of removing that pinching needle.
Okay.
So occlusal prematurity create a emergency.
Yes, sir.
Okay, if it is a pinching needle below any the person,
Okay,
so
sir.
it will create an emergency.
Yes, sir.
So you need to examine properly
Yes, sir.
so that you find the prematurity
Yes.
and reduce it. Failure to find that proper prematurity, like if this is a prematurity and you are removing this,
This.
so there will be more prematurity. Failure to find the occlusal prematurity will create more prematurity.
Yes, sir.
So you need to be very disciplined because occlusal adjustment is irreversible, invasive procedure.
Okay, sir.
It is a destructive procedure. Teeth are removed, the portion of the tooth is removed. So you have to be very, very careful
Okay, sir.
and slow. Okay? So if you are not disciplined and your knowledge about the occlusion is not good, you will
Okay.
create a problem. Patient will not be relieved. Okay? Once you find and remove the occlusal prematurity, it will give immediate relief.
Okay, sir.